Hi, Dr. Barker here at Peak Plastic Surgery. So we've been getting a lot of inquiries lately about when is surgical skin tightening needed versus non-surgical skin tightening. This is a great question. However, gets very in the weeds in terms of understanding the differences between the two. So when we're talking about non-surgical skin tightening, this has to be for patients that have the appropriate skin quality, the appropriate amount of skin excess, and the appropriate expectations for the devices. What I mean by that is when we think about skin quality, when we get to about the age 40, 50, sometimes a little sooner, sometimes a little later, our dermis, which is the layer of our skin right under the layer we see, starts to thin. But that is the layer that's the strength layer that gives that skin tightening quality. When we start getting older and it starts thinning, these devices may not work as well. Also, if you have too much skin, even if it's high quality, the devices may not give you the results you're hoping for. If you have skin that is damaged, this is typically skin that has a significant amount of sun exposure or stretch marks. This comes with age, this comes with weight gain and weight loss, it comes with pregnancy. So our men and our women patients have equal amount of questions on this. So again, with the non-surgical skin tightening, we're thinking about more getting subtle changes. They don't have too much excess skin. They have high quality skin in the areas of concern. Then when we switch over to the surgical skin tightening, this is more of a surgical removal of skin to give the appearance of skin tightening with the remaining skin. We talk about this with patients that are undergoing tummy tucks, circumferential body lifts, arm lifts, thigh lifts, breast lifts, procedures like this. These are typically for the patients that have a significant amount of skin excess or damaged skin with those sun exposed areas or stretch marks. But again, understanding the differences between surgical skin tightening, which is actually removal with the appearance of tightening when we're done, and non-invasive skin tightening needs to be understood by the patient with the care of speaking to myself during the consult. So when my patients come in and are inquiring about when is surgical skin tightening required versus non-surgical skin tightening, I will sit down with you and go over all expectations and why I would recommend one versus the other. That will give you the understanding of, okay, I would be a candidate for it, and this is what I should expect at the end. Or here's the reason why I'm not. But understanding that is of paramount importance because you're making this decision to get the result you're hoping for. That is why I take so much time with my patients in their consults to understand why I recommend each modality, or I don't recommend it and we go straight to surgical excision. There's also combinations of surgical excision with skin tightening after. Again, when is surgical skin tightening required instead of non-invasive skin tightening? The question leads to more questions typically, which is why you need to come in for a consult with me and I'll sit down and I'll explain all of it to you. And I have each modality. I have the non-surgical skin tightening machines, and I can offer the surgical excision to give you skin tightening appearance. So again, the differences between the two could not be any bigger gap between them, but understanding why there's a difference, understanding why things are being recommended, again, gives you the comfort in understanding I'm making the right decision and I have the expectations of how it will look and I will get those results. So again, when is surgical skin tightening or excision of the skin required versus non-invasive or non-surgical skin tightening? Understanding the differences between the two is the key. That is what I provide in my office with my consultation process. That's what you should understand and you should feel comfortable with at the end of the consultation, knowing you're making the right decision. So if you have any further questions on these things, understanding things a little more, understanding your options more, please let me know. I'm happy to discuss with you, and I look forward to chatting with you more. Thanks.